Most peanut allergies can be prevented through early food introduction, yet many families never hear this message. Listen to this episode to hear how agricultural research funds allergy prevention programs, why school peanut bans don't work, and how dietitians connect food systems to health equity. You're listening to the PHEC podcast, episode 444. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to the community partners as well as the broader communities they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. I'm excited to introduce you to my guests on this episode. Most families have never heard that peanut allergies can be prevented through early introduction. Markita Lewis, registered dietitian and marketing communications manager for National Peanut Board, works at the intersection of agriculture and public health. In this position, Markita helps drive commercial and non-commercial food service partnerships, nutrition and food allergen management education for K-12 school food services, and college and university dining. She provides education and research support for food allergy prevention and guides the National Peanut Board's general nutrition education and health communications. She obtained her undergraduate degree at Louisiana State University in nutrition and food services, concentrating in dietetics with a minor in psychology, and completed a combined master's degree and dietetic internship program at the University of Georgia. Markita received the Distinguished Service for Media Excellence Award from the Georgia Academy of Nutrition and Dietetics in 2025. From funding nearly $1 million in food allergy research to developing early introduction programs that work with pediatricians and WIC, her work challenges common assumptions about allergen management. This conversation explores how evidence-based allergen prevention reaches communities, why school peanut bans create false security, and surprising ways food systems shape chronic disease outcomes for millions of families. Let's connect my conversation with Markita right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Hi, Markita. Welcome to the podcast. How are you?
I'm doing well, Dr. Huntley. How are you today?
I'm doing well. I'm excited for our conversation, and I have some little gadgets I'm going to be holding up here. I'm going to start off. People that are listening only and you can't see this is a little sticker. Here we go. If you're watching, you can see it. But it's a little sticker. It says National Peanut Board, We the Peanut. And I'm just such a nerd. I think that's so funny. But I met you at a conference and you had all this great stuff there and we chatted for a little while and I knew I wanted to invite you to be a guest on the podcast. So why don't you take a moment and just introduce yourself, and tell everyone a little bit about who you are and what you do.
All right. Well, hello, podcast people out there listening right now. I'm Markita Lewis. I'm a registered dietitian and I'm the marketing and communications manager for the National Peanut Board. And yes, there's such a thing called the National Peanut Board. We're an agricultural commodities board that represents all of America's peanut farmers. And what I do as the board's registered dietitian, I do a lot with nutrition and allergy. We'll definitely get into that a little bit more, but I can share a little bit about how I got to the board in the first place.
Yes, I'd love that. That's one of my favorite questions because we would definitely dive into some details about peanuts and all that you do. But please do share about how you got here, especially interested in knowing when did you first learn about public health?
So I came to public health by virtue of loving food. So I'm originally from Louisiana, Southeast Louisiana. And so, we've got a really big food culture. You've got the Cajun food, you've got the Creole food. And when I was younger, I really thought that I was going to become a chef. I was like, my mom gave me my first cookbook when I was 3. She was always cooking. We watched cooking shows together. I got to meet Chef John False once when I was a kid, and I was like, "I wanna be a chef like you are." But then when I was growing up a little bit more, kind of in middle school, I was thinking, "You know what? Chef life is a little bit stressful and hectic, and I really like the idea of being able to help people, to counsel people, to help them figure out the issues that they were having in their personal lives and finding a way to marry that with the love of food. And so naturally, like dietetics and nutrition is at its core like food and nutrition counseling. So it's like, great, this is perfect. I get to have a career with food and help people in the best of both worlds. And so I did my undergrad in dietetics with a minor in psychology at the Louisiana State University. Did a lot of research. I was a McNair student, and that's what actually convinced me to not just do my dietetic internship and then take the RD exam. But I was like, no, I want to get my master's degree. I want to do some research. I want to learn more. And then I really want to say when I was in undergrad, that's when I really started thinking about health and wellness beyond the one-to-one experience. Like, oh, you have sole responsibility for your health outcomes. So when I got into college, started learning more about the world, started learning more about some of the systemic inequities that were happening in the world. That's what really introduced me to public health, like really looking at those systems and how can we improve those systems to help more people. So that was, I think, a little bit of my focus when I was in grad school for my master's degree in dietetic internship. I was very fortunate to be in Dr. Lee's lab over at the University of Georgia, where I got to work with her PhD student at the time who was doing some research on food purchasing practices of older adults and kind of looking how SNAP and those benefits were used and what was the nutrition of the people getting these things. And then my master's thesis was looking at participants in a SNAP Ed program, seeing what were the kind of foods that they were eating, knowing that SNAP Ed has a cooking component, an educational component. And I was like, we're in the South. And I'm like, I've always been a person who's like, not all Southern food is unhealthy. We're an agricultural region. We have so many fruits and vegetables and other types of things. How do we incorporate these natural cultural foods into healthy eating, into these programs where people are learning about health and nutrition without feeling like they have to give things up? So that was something that I really enjoyed in my master's degree. But then to kind of wrap things up a little bit, I ping ponged from Georgia worked in Los Angeles, clinical inpatient, my first dietitian job at what's now Los Angeles General Medical. They changed the name after I left, but I did clinical inpatient for most of the time, seeing adults, but I've done everything from ICU to the pediatric ICU to everything in between. And then while I was in the hospital, I really missed that creativity. Like, I've always loved writing, and so I did nutrition writing on the side for a few years, like, alongside my full-time job. And then when I left working at the hospital and trying to figure out what my next step was, I was like, "All right, instead of maybe getting my CDCS and then being a diabetes educator, I pivoted to I want to do more communications, more of whether it was like nutrition, copywriting, or something like that. And it was just perfect timing that I was looking for a job when the National Peanut Board had something available. They were looking specifically for a registered dietitian who had communication skills, who had basically all these things that were like, I think, like, were they spying on me? Did they write this job for me? And so I applied for it, and only a couple of months later, I found myself in Atlanta, Georgia.
What a great story. So, first of all, you're next door to my family, my mother's side of the family. So, we're South Mississippi along
Okay.
the Gulf Coast. I'm very familiar with Louisiana because there are a lot of cousins, Slidell and in New Orleans area. So, all the food, the culture, I completely relate. And as you were describing that, my thought was like, I wonder if she made a healthy version of gumbo.
I mean, gumbo is gumbo. Here's the thing, you're not eating gumbo every single day. I'm very much of the all foods fit kind of ideology. I think there's nothing to be gained from denying yourself because that's when you start having unhealthy relationships with food. It's just about what's the proportion it takes up in your diet. I mean, I had gumbo for Thanksgiving. I made a good chicken and
Yeah.
sausage gumbo, but I'm not eating that every day. I'll make a Indian curry with a bunch of vegetables, or I'll make a nice pasta dish with broccoli rabe on the side, but I'm still gonna eat gumbo and different things.
Right.
I'll be home soon, so I'll be doing that a little bit more.
I love that. And I also love your journey. I think it's nice when you can bring your skills. You discovered you have this skill, these communication skills in writing while you were working at the hospital and being able to find, like you said, that this job was written for you. You can bring all of that together. That doesn't happen to everyone. So I think it's wonderful whenever it happens, but I know you can appreciate all of that coming together. So that's just really, really nice to hear. So let's talk a little bit more about the peanut board.
Alright.
Because this is new to me, I'm still fascinated. I mentioned to you before we started recording, right after we met, I came back home and there was this in the town over for me, there was this festival, peanut festival, because they apparently grow well here. I've never grown
Mhm.
them in my garden, but there was a peanut festival and a car show, and so my husband was lined up in the antique car show, and I was, like, wandering the festival because it had, like, vendors and all these crafts and so much food. And there were, like, so many different flavors of boiled peanuts. So if you're listening to this and you're like, "What? That sounds gross." You gotta come to this if you come to the South, don't knock it till you try it. It is
Yeah,
actually
you have to try it.
yeah. They even had Cajun, which I had never had before, Cajun boiled peanuts. So I thought about you as I was we were going through this peanut festival, even had a parade. It was really, really a small town country living. I love it. But I would love to know more about the peanut board because I have here some other items, a little flyer that I pulled from your booth, and there's so much information here that is really just a lot to be learned. So I'm going to let you just go into the peanut board a little bit more and maybe speak to some of the specific programs and work that you do and this connection to public health.
Absolutely. So, as I mentioned earlier, National Peanut Board were one of the agricultural commodity boards, which were under USDA and the Agricultural Research Services, so ARS. And so we were formed through some legislation in the mid 1990s, but there's actually quite a lot of ag boards. One of my favorite that I like to tell people about is that there's a Christmas tree board. And so basically, we do what we can to help our farmers economically, either through marketing and promotions or supporting research that helps them on the agriculture side. And so you might be wondering, so how did peanut board get involved with public health? Like it doesn't immediately become apparent, but when you think about peanuts, I'm sure one of the first things that people think about are allergies, right? And so one of the things, right, when the board was formed in 2001, they're like, hey, people are thinking that peanuts are an issue or problem. They shouldn't be growing something that might be hurting people. But like the farmers have so much pride in what they grow. If you ever have the chance to speak with a farmer, just listen to their story because often it's a multi-generational story too, of them talking about their memories, what they have now, what they want for their children. And so one of the big things they're like, we want to help create a future and where peanut allergies don't have to be an issue for people. That one day there aren't any peanut allergies if possible. And so that's kind of how the board got involved with the world of peanut allergy. There's a lot going on with the board. As a registered dietitian, I do a lot primarily focused on allergy, whether it's allergy prevention and early introduction. So the concept that if you, instead of delaying introducing allergens, you're introducing allergens around 4 or 6 months when that child is starting to eat all of their regular food, they're starting to wean off of breast milk or formula, and you're getting those complementary foods. And that's really significantly decrease the likelihood of a child getting a peanut allergy. So, early introduction is one part of my job. The other part is allergy management, especially as it comes to K 12 schools and college and university food service, because I'm sure at least one of y'all listening has either been to a school or have heard of a school that's had a peanut ban. And we can kind of talk about that a little bit later as well. But we do a lot at the board. Like for such a small team, we do so much. So with early introduction, we do a lot of work with providers as well as professional organizations. So the American Academy of Pediatrics, National WIC Association. We've done things with the Pediatric Nurse Practitioners Organization. There are a lot of organizations that we work with to develop resources to help them talk about early introduction, as well as developing networks and other things so that more people are telling that story so that hopefully we have generations. Well, we're already seeing research showing that peanut allergy rates are going down. So we're glad that maybe part of our work is the reason for that. That's just one part. We fund research. I know a lot of people might not know about that. So National Peanut Board, we've been funding research since we began. Some of the research that we funded actually helped lead to the LEAP study as well as some other very meaningful research. And for the past 2 years, I was able to lead our food allergy grant program where we helped award, in the past 2 years, we've awarded about like $950,000 to food allergy research and programming across prevention, diagnosis, treatment, and management. So that's another bucket of what I do. But there's still more because obviously we do things with colleges and universities and K 12. So getting resources so that all of these school districts are able to use evidence based practices in food allergen management because research shows, and even the American Academy of Pediatrics emphasizes that food removal, food ban policies alone aren't enough to keep kids safe. Actually, might not actually do anything because it creates a false sense of security. So, what we actually need is comprehensive food allergen management. So, we give a lot of tools in that way. And then for schools who serve peanuts, we give them fun recipes. And then, lastly, I guess the last bucket of what I do is obviously as a dietitian, talking about nutrition and health benefits. What does the research say about peanuts and certain health conditions? And then communicating that with other dietitians and healthcare providers so that they're able to show people like, hey, here's this affordable and nutritious food that you can eat, like making nutrition and attaining health a little bit more accessible. So that was a lot.
Yeah. Yes, it was, but I think it's really interesting. Something that you said got my attention, and this is about, I guess, this idea about the prevention of peanut allergies. So, looking at this flyer, if you remember this one I got from your booth, it
Correct.
says 86% of peanut allergies can be prevented.
Mhm.
And so, does that kind of connect to what you were mentioning about how the peanut bans aren't really effective?
Well, those are two separate things.
Okay.
So, when we're talking about peanut bans, we're definitely talking about allergen management in schools for those kids who are a little bit older. So, there's been some research studies looking at kind of in schools that ban peanuts versus those who don't. Does that have any impact on the like rates of people needing to use epinephrine of allergic incidents in that school? And research shows that it doesn't actually have an impact, and it also might increase the likelihood of an event happening on campus because it's like they think that, oh, we said we banned it, that we're good, we're done, and no one's ever going to bring in peanuts as a snack or something else. So, like, you never know if, say, in back of house, there's an ingredient substitution, or someone
Okay.
brings in a snack, or someone has a party, and then if you're like, well, our only management plan was to ban peanuts. We don't have things like epinephrine on hand. We don't know who to
Oh, okay.
contact in case something happens. We don't have maybe the proper labeling and things to make sure that these cross contact issues don't happen. And so that's why we're always saying like comprehensive food allergen management plan. It's a lot of communication. It's a lot of having steps in place versus, oh, well, we don't have it, so we don't have to
I
think about it.
gotcha.
So, going back to an allergy prevention, so yes, there's a statistic showing that early introduction can help reduce the rate of peanut allergy up to infants, up to 86%. And so those numbers come from a few studies, including the LEAP study that was published in 2015, where basically it came out of researchers, Dr. Gideon Lack and his lab out of King's College, London, seeing that when you were looking at rates of allergy, so say they were looking at Jewish children, they were looking at the rate of allergy in London versus the allergy rate in Israel. They initially found that, like, wait, the children in Israel in this area, they did not actually have any peanut allergies, which was just strange. They're like, what's going on here? And so one of the notable differences that they had was that those children in that region, they were fed bomba, which is this little peanut puff snack. If you can picture it in your mind, what if you had a Cheeto puff, but it was made out of like peanut? And so I found that like, oh yeah, we give these kids this like as soon as they can eat, basically. That's a part of their regular diet. Kind of for a similar reason, you don't see a lot of peanut allergies in many areas of Africa or certain areas of South America because peanuts are such a integral part to their cuisine. But yeah, they did a study looking at young infants. They had half of the infants stick with some of the old American Academy of Pediatrics guidelines, saying, like, I think they said that you don't necessarily have to wait 3 years to introduce peanuts, but, you'll see. And then this one was like, no, we're going to introduce it early. And we're going to see if this ultimately decreases the rate of allergy, and especially in those children who are high risk. So, meaning that they either have a egg allergy or they had severe eczema or both. So, at the end of the first phase of the study, they found out like, oh man, and the children who got the peanuts significantly different outcomes. Like, yes, they were way less likely to develop a peanut allergy. There were a couple of other studies, the EAT study that came out, I think, in 2016, that showed similar things for both peanut and egg, that it was early introduction was effective. And those studies really changed the game. The American Academy of Pediatrics changed their guidelines. NIAID from the government was like, let's update our guidelines for allergy prevention. And so from then on, we, as well as different academies from around the world and advocates around the world, have been like, early introduction, it is an accessible and affordable way to prevent peanut allergies, which, comes with its own set of public health implications. So that's what the statistic comes from.
Well, thank you for explaining that, both aspects of that with, you know, the need for the comprehensive, not just removing of peanuts, but the whole comprehensive plan in schools, but then also the early introduction as a way of reducing peanut allergy. That's really interesting concepts. And I'm loving this conversation so much. There's something I want to ask you about, and I think this is a great conversation. It's a great way for us to kind of skip ahead a little bit. Often, especially on this podcast here lately, we've been really talking more about explaining public health in plain language, really helping people understand what we do, what public health is, kind of like our friends and family, helping them understand public health through the lens of which we work. And that's like the easiest way to really share an example and help them to understand. So I'm excited to ask you about this, especially because I would love to know, there's such an incredible opportunity to share a public health explanation through this talk about peanuts and allergens. But so my question is, how do you explain the importance of your work, what you do and the connection to public health in plain language conversations, with your family, friends, and community?
Absolutely. So, a very funny thing that whenever I start explaining that I work for the National Peanut Board, I have to do two things. One, reassure them, yes, this is a real organization. This is a real job. But then also let them know that I don't work for Mr. Peanut. That's a whole different organization. So, once I get those two out of the way, that's when I kind of just start talking about allergy. Because if you think about it, and I'll talk to them like everyone has been affected by an allergy in one way or another. Whether you know somebody, there's around 32 million people in the United States who have a food allergy in general. You might know someone who has a food allergy. You go eat out and you hear something about allergies. And so I think you think about that where it's like, oh, wow, yeah, the conversations about allergy are ubiquitous, even if you're not thinking about it all the time. I think when you say, oh, hey, a lot of my work has to do with peanut allergies, like that is the first, first dot for public health. But then I kind of get into, when we're thinking about facets of public health that we want to have an impact on, I like to talk about some of the data that people might not know, like some of the social determinants of health that they might not know about, so that they really understand the urgency of why we're doing this work and how it really affects the communities that they're in, even if it might not affect them personally. So, like, most people don't know that a food allergy can cost someone $4,000 a year or more. And, we're thinking about the current economic state and how much money we do or don't have. So, you think about that. You think about how, like, you don't have as much access to healthcare in some regions, or if you're lower income, but you might need that allergist. You might need special care. You might need that emergency room visit. Also, just being Black, just talking about, yeah, Black and Hispanic Latino people have higher rates of allergy. And that could be influenced by a lot of factors, whether it's that access to healthcare, exposure to pollution, all of these other factors. And so I think that's what really gets them to understand, like, oh, yeah, this is really important. And I think also framing allergy as a chronic disease, as a chronic condition, really helps them understand because they understand heart disease, they understand diabetes, they understand a lot of those other things. Like, frame allergy the same way. It is a chronic condition that requires management. And then also with my work specifically, really framing it around like disease prevention, preventative medicine. And so basically, hey, when we're talking about early introduction and allergy prevention, it's with the same cadence and thought and care that we're talking about eating fruits and vegetables, about getting exercise, about drinking enough water, about whenever, you have your children when they're young, like you're introducing foods, you're helping them walk, you're doing all the things that they need to do in order to succeed in life and, at least hopefully grow up as easily as possible. Allergy prevention and early intro is the same thing. You're already feeding your child, feed your kid those allergens, and then, yeah, save yourself $4,000 or more per month, or at least increase the likelihood that you can save that money and not deal with the psychosocial impact and all these other things.
That's really good. This has been a fascinating conversation and very refreshing for me. I love the example of a very, something that we see all the time, think about, probably eat regularly if we don't have an allergy, and being able to bring this different public health message and example and story. And now we're all aware of the peanut board. So that's like another
Yeah.
very unique and very refreshing new insight to share. So thank you, Markita, for taking time and coming on the podcast, being my guest and chatting with us about all things peanuts.
Thank you. Before I go, I forgot I was going to show off Little Peanut. So, this is our boy, Little Peanut. This is actually a tool that we created to kind of help providers have the conversation about allergy prevention because this isn't intimidating. This isn't scary. This is like noticeable too to help people remember. And
Yeah.
so, this kind of mascot for early intro and hopefully creating a future where there aren't as many peanut allergies.
He makes me smile. That was what I noticed him first when I stopped by your booth, and I gotta figure out how to get one of those because I think that's just the cutest thing.
Well, I'll just say if you're a provider working in peds, there is a way for you to get one, and there might be a storefront later for other people, but that might be something a little later down the road.
So if you're listening to this and you don't have the video, she just showed an adorable, cute, plush, smiling peanut. So worth finding our video so that you can see this. But that's just, and on the little flyer, it says, I'm on a mission to prevent peanut allergies. Signed, Little Peanut. Adorable. I think that one of the things, I mean, I'm genuinely fascinated with all of this. And this is really a lot of new information and just stuff I hadn't thought about. I think the refreshing change of pace for a topic of the podcast is welcomed. I appreciate it, even if no one else but me appreciates the change of
Thank you.
pace. But I also think that it's another reminder of just how broad public health is and that how there's so much for us to talk about and to learn, new and different every day. So thank you for being here. I really do appreciate you.
Yeah, thank you for having me. I love that you reached out, and I'm glad to speak to the public health audience at large. So, thank all of you listening right now.
Awesome. The links to connect with you will be on the show notes page, and I'll tell everyone how to find that in just a moment. But just for someone listening now, what's the best place to connect with you?
With me personally, LinkedIn, but I absolutely recommend for more information on everything I spoke about today, go to nationalpeanutboard.org. And then it'll have everything from early intro, some tasty recipes, etc. We got you covered for all things peanut.
Perfect. Thank you so much.
Thank you.
I really hope you enjoyed that conversation as much as we did. Markita's work reminds us that public health solutions often emerge from unexpected places. Whether it's agricultural boards funding allergy research or early introduction preventing chronic conditions, effective strategies require collaboration across traditional boundaries. Her approach demonstrates how plain language communication transforms technical evidence into accessible health equity tools. Food allergies create significant financial and health burdens for families with disproportionate impacts on Black and Latino communities. When we connect agriculture, nutrition, and preventive medicine, we create pathways for healthier futures. Your expertise matters wherever you apply it. I encourage you to connect with Markita and learn more about the great work that she's doing at the National Peanut Board. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 444, can be found at phecpodcast.com. Once you're there, just navigate to episode 444 to find its show notes. One more thing before we go. Remember that our podcast has an app and private community, independent of social media platforms, where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes like this one. You can download our PHEC Podcast Community app in your mobile app store, and it is available to both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.